To tell the story of the resistance, we need to go back in time to the man who first conceptualized the resistance in modern psychotherapy. That man, of course, is no other than Sigmund Freud. Early in his psychoanalytical practice, Freud noticed that he had to contend with a strong resistance as he approached memories, feelings, experiences, and distinctional drives that he believed were at the root of his patient's symptoms. In his book Studies on Hysteria, while describing his work with a young woman named Elizabeth, Freud writes,
In the course of this difficult work I began to attach a deeper significance to the resistance offered by the patient in the reproduction of her memories and to make a careful collection of the occasions on which it was particularly marked.
This insight led Freud directly to the idea of repression. He proposed that patients were actively keeping certain material and drives out of conscious awareness, repressing what they didn't want to face, and that this hidden part was often the true source of their suffering. That part, he believed, was buried deep within what he called the unconscious, the part of the psyche lying beneath the surface of awareness. To help explain this concept, Freud famously introduced the iceberg analogy, suggesting that only a small part of us is conscious, while the vast majority remains submerged in the unconscious. And so, in order to bring repressed material to the surface, Freud introduced interpretation, a technique aimed at making sense of and giving meaning to the patient's unconscious experience, ultimately paving the way for integration. However, as we already mentioned, one powerful force obstructed the analysis and completely blocked the influence of interpretation. That was the force of resistance. Resistance ensured that the buried parts of the psyche remain hidden, directly opposing the central aim of the analysis and the patient's conscious desire to reduce their suffering. It didn't take long for Freud to realize that resistance was not a minor obstacle, but rather one of the most important forces in therapy. Consequently, the central question quickly became, how do we deal with it? To answer this question, let's take a sneak peek into Freud's writing. In his article, Remembering, Repeating, and Working Through, Freud writes, the first step in overcoming the resistance is made, as we know, by analysts uncovering the resistance, which is never recognized by the patient, and acquainting him with it. One must allow the patient time to become more conversant with resistance with which he has now become acquainted. To work through it, to overcome it, by continuing, in defiance of it, the analytical work, according to the fundamental rule of analysis, the rule of free association. Only when the resistance is at its height can the analyst, working in common with his patient, discover the repressed instinctual impulses which are feeding the resistance. And it is this kind of experience that convinces the patient of the existence and power of such impulses. The doctor has nothing else to do than to wait and let things take their course, a course which cannot be avoided nor always hastened. To recap, Freud approached resistance in two key steps. First, he would introduce the concept of resistance to the client. Then, he moved into a phase of working through to uncover the repressed impulses that were driving the resistance. In this process, the therapist often played a mostly passive role, patiently waiting for the analysis to unfold. Freud also saw resistance as an essential part of psychoanalysis, a crucial factor that, although obstructive, was intimately tied to the transformative changes his patients experienced. For Freud, resistance was obstructive, omitting factor, a nuisance that hindered the analysis, much like a roadblock that needed to be cleared to continue on the therapeutic path. However, Freud wasn't always clear about how to overcome resistance, and many questions remained open. How exactly should resistance be introduced to the client? When and how should interpretation be delivered in light of emerging resistance? How active or passive should analysts be in the process? How much patience should an analyst have? And how can one be sure the analysis is truly progressing? These were just some of many theoretical and practical challenges faced by psychoanalysis. Yet, one of the Freud students, a Viennese psychiatrist, took a special interest in these questions, especially the problem of resistance and its role in psychoanalytical process. His name was Wilhelm Reich.